thought I would put on a video today. I'm aiming for around an hour in length, looking at gender diversity, helping staff, especially in the NHS or other healthcare settings, to understand the difficulties that people from our gender diverse communities might experience, and encouraging us all to reflect on how we could improve our practice to make it more inclusive. What has encouraged me to make this video is I've worked in the NHS myself, coming up to 9 years. I've worked in hospitals, community teams. I've also worked in primary care settings, all mental health services for me. I'm a CBT therapist. But in all these sort of different settings of the NHS, I have come across people using sort of incorrect pronouns, using a patient's dead name, and even patients themselves complaining about the way how they feel they're being treated by NHS staff and other healthcare professionals or other professionals in general. I think it's a really important topic. It's something that I'm passionate about for healthcare staff and professionals to improve the service we provide, and I guess that's why I'm wanting to run this today. So I hope you find it helpful. I'm going to put my presentation up and we can get started. So what I want today to be about is considering the needs of our transgender patients and patients that would fall under the umbrella of gender diversity. In particular, I'm focusing on NHS and mental health services because that's where I work. But I hope it's going to be helpful for a variety of professionals in lots of different healthcare services. So today, what I want to cover, first of all, I want us to go through some common terms. Often people are a little bit confused about the terminology used for the gender diversity, so I'd like us to go through that. We are going to take a closer look at mental health and suicide rates in the transgender and gender diverse community. There is a really useful report on being trans in the UK, and I'd like to have a look at that with you to share what it's like to be gender diverse in the UK and what those experiences might be like. I also have some research looking at the experience of gender diverse patients under the NHS and other healthcare settings, just to shine a light on the issues that are happening. I'd like us to talk about why respecting pronouns is important, how we can do that, understanding it a bit more, and also just reflecting on what we can do as professionals to provide better, inclusive and equal care. There's some moments for reflection throughout, and also there's some useful links at the end. I'm sharing my references, and I'm also sharing some helpful signposting for your patients that you can give out. So just to tell you a little bit about myself, I'm not an expert by experience, so I would consider myself cisgender. I'll explain what that means in a moment. But I wouldn't consider myself on the gender diverse spectrum myself. But I do think it's not the responsibility of the LGBTQ+ community to educate us. It's our responsibility as professionals and decent human beings to educate ourselves. I wouldn't consider myself an LGBTQ+ expert at all. I am just someone who's a passionate ally, and I'm keen to keep learning myself. So, you know, things may not be 100% perfect today, but I'm trying. So my name is Molly Smith. I'm a CBT therapist, or a cognitive behaviour therapist. I work in the NHS and mental health services. I would like to consider myself an ally. I wouldn't identify myself as gender diverse, but on a sexuality spectrum, I would say I'm on a fluid spectrum, an ever-changing fluid spectrum of sexuality. So in that sense, I guess I would consider myself part of the LGBTQ+ community. If you want to follow me on Instagram, shameless self-promo now. This is my Instagram account, it's CBTMme. I like to post lots of things about CBT, lots of self-help and information videos. I've also got a Facebook, and I do have a YouTube channel where I post my videos, so feel free to check out some other stuff I do. Before I start my presentation, I do want to say that I'm aware my audience listening right now are also going to be diverse, and NHS staff ourselves are diverse. We all have our own identities, our own histories, our own cultures, faiths, our own beliefs and views. We have differing opinions and differing experiences as well. And I understand that this presentation may be uncomfortable for some people, and some people may differ in their opinions on what I've got to say today, or have personal conflicts as well. But what I will ask is that you listen to the information that I'm providing, and that you respect the information that the research is sharing as well today. I would say, regardless of your opinions, we can all agree that as NHS professionals, it's our professional duty to respect our patients that we care for. It's our professional duty to provide equal and inclusive care to our patients. And it's our duty as well as professionals to abide by the Equality Act and also our NHS values. That is something I think all professionals can agree on, just regardless of what your opinions or other standpoints might be today. So without further ado, I'd like us to start with some terminology, because I know there is a bit of confusion for terminology. So cisgender, what cisgender means are people who identify as the sex they were assigned. So I was born female with a vagina and I identify as female as well. So I am cisgender. You may have heard the term gender dysphoria. This is a diagnosis. It's often used by doctors. It's used to describe the distress, the unhappiness, and the anxiety that someone who may be gender diverse or transgender may feel when they're in the wrong body. It's not the body that they, identify with in terms of their gender, I guess. It can be a formal diagnosis. It's also called gender identity disorder. I guess there's a bit of debate on this as a diagnosis, because a lot of people would argue that gender dysphoria, well, there's nothing wrong with you if you're transgender, non-binary, gender fluid, or anything else under the gender diversity umbrella. There's nothing wrong with you for that, so we shouldn't label it as a disorder. But some people do find it quite helpful. And in terms of things like insurance or I guess a gateway for getting treatment, that can help sometimes in the transition period. So some people do find it helpful, some people don't. What does the word transgender mean? Sometimes it's shortened to trans. This is a term used to describe someone whose gender identity is different to the sex that was assigned to them at birth. So for example, if you were born with a penis and assigned male when you were born, but you personally identify as female, that may be someone who would come under this term, transgender. Some people put trans with an asterisk, which is just to expand the word to include all people with non-conforming gender identities and expressions. So we'll come on to that in a moment. So a transgender man is what I've just described. So somebody who was born with a vagina, assigned as female as their sex when they were born, but they identify as male. So they view themselves as male. And many trans men would not call themselves a trans man. They would just call themselves a man, because that is what they are. That is their identity. That's who they are. A transgender woman then is kind of the opposite in that sense. So this is somebody who was born with a penis. Their sex was male when they were born, but they identify as female. And again, lots of people wouldn't call themselves a transgender woman. They would just call themselves a woman, because that's who they are. You may have heard the term cross-dresser. This is sometimes shortened to CD. It's also often called drag these days. I'm sure lots of people have seen things like RuPaul's Drag Race. So cross-dress is wear the clothing of another gender. Sometimes it's to have fun, sometimes it's emotionally satisfying, sometimes it's political, about gender roles. People can cross-dress for all types of reasons. Drag is often, you know, someone who dresses in a quite an extravagant, larger than life kind of way. Thinking of like a drag queen or a drag king, they're quite exaggerated, but really fun and really cool. Watch RuPaul's if you haven't seen it, it's great. Gender non-binary is another important term. I do feel this is sometimes something that isn't understood and often a bit overlooked. So gender non-binary is where your gender identity doesn't fit into those traditional boxes of male or female. So you may view yourself as non-binary, meaning that you don't fit one of those binary categories. And again, everybody is different. Gender fluidity, I'm going to explain this, I guess, in terms of my own experience. So I would say that I am on a fluid spectrum in terms of sexuality. I wouldn't say I was 100% straight. I wouldn't say I was 100% gay either. I personally don't feel the label bisexual fits me. So the word fluid, I guess, explains it best. So it's fluid like water, it's changing, it's moving. So one day I may feel a little bit more straight, other days I may feel a little bit more bisexual or lesbian. It's sort of an ever-changing spectrality, which is fluid and adaptable and changeable and forever moving. It's not set in stone. And that's the same when we talk about gender fluidity. So it's a sense that your gender isn't set in stone either. It can change over time, it can change day to day. And gender fluid for some people is the best fitting sort of identity for them. They may not want to fit into male or female. They may feel different day to day. Some days they may feel more male, or more female. Some days, you know, they may feel neither. It's fluid, it's changeable. And actually, a label isn't always helpful to some people. I certainly don't think it's helpful for me to label my sexuality. Some people may also call themselves genderqueer, which is, again, a sort of term often used for that fluidity there as well. So I hope those terms help just to get a bit of an understanding. I think they're good terms for everybody to be aware about. And again, it's good to be aware about these things in healthcare. If you have a patient who says that they're non-binary, I hope that makes a little bit more sense now what they're talking about. So we're going to go on to now mental health for the gender diverse community. So I've got some really good research projects here. So this first bit of data comes from a Stonewall report. It's the LGBT in Britain report. There's some really good research there. They were asking a lot of people for their input here. So this is for the LGBT community in general, not just the gender diverse sort of part of that community. So 52% of the LGBT community said that they've experienced depression in the past year. That is a much higher rate than the general population. I think in general, mine say 1 in 4 of us can experience a mental health problem at any given point in our life. This is 52% in the past year. So it's not at any point in our life, and that's a staggering higher amount there. 1 in 6 people from the LGBT community said that they drank alcohol every day last year. There are sort of some higher rates of difficulties with substances and alcohol. 3 out of 5 people said they struggled with anxiety in the last year. Again, that is higher than the other population. If we look at the British population on the whole, that's a lot higher. 4 out of 5 non-binary people struggled with anxiety in the last year. I mean, that's very high, isn't it? That's like 80 or 90% there of non-binary people struggling with anxiety. Again, if we compare that to the British population, that is a staggering difference. We've got a really high amount of anxiety and mental health difficulties in this group. That's what it's pointing out. 1 out of 8 people experience an eating disorder in the past year in the whole LGBT community. And 41% of non-binary people, 20% of LGBT women, and 12% of LGBT men self-harmed in the last year. Now, what this information is telling us is that mental health difficulties and suffering is higher in the LGBTQ plus community overall. For suicide attempts, this comes from the Trevor Project, again, a really good charity. They do a lot of research for the LGBTQ plus community. 78% of the LGBT community reported thinking about ending their own lives when they were surveyed. 40% of the people surveyed had made at least one suicide attempt. And 76% felt their mental health had improved after transitioning. So that's a positive thing, isn't it? That their mental health improves when they're transitioning to the gender they identify with. 81% of transgender people said they thought about suicide more before they were able to transition. So it means that when they transitioned, they felt about suicide less. And I think that's important, that, you know, things can also improve a little bit in terms of someone's safety when they're able to live in the gender that they identify with and express their gender identity. In virtually all of the people that admitted to attempting suicide, they said this was because of frustration and exasperation over their gender dysphoric condition, if you're happy with that term. These people said that they reached a breaking point. They felt isolated. They felt unable to talk to other people. They felt rejected by their family or an intimate partner. And it's very common people may feel disgusted with their anatomy and their body too. Imagine feeling trapped in the wrong body, not the gender you identify with, and feeling hopeless, like you can't change. It's no wonder people in the LGBT community would struggle with mental health and suicidality compared to the sort of normal British population on whole. When I say normal, what I'm meaning is the population of Britain on whole. I'm not saying the LGBTQ plus community are abnormal. They are not. I want to make that very clear. So let's go into this in a little bit more detail. Why are these mental health and suicide rates higher? Well, again, let's have a look at what it's actually like to be gender diverse in the UK. This comes from Stonewall. It comes from the LGBT in Britain document. So 14% of trans and 24% of non-binary people said that they can't be open about their gender identity to their family. They're having to sort of hide who they really are, hide their gender identity to the people they probably live with and love with and are close to, their family. 11% of people surveyed were not supported by their family. And in fact, only 20% of the whole people surveyed said that they felt their family were supportive. I mean, that's massive, isn't it? Imagine having a family that aren't supportive of basically who you are. Your gender identity is part of who you are as a person. That's so isolating and must feel incredibly rejecting. 2 out of 5 trans people and 3 out of 10 non-binary people have experienced, this should say hate, sorry, have experienced a hate crime because of their gender identity in the last 12 months. That's not even in their life, the last 12 months. Just imagine that. Just imagine being scared of who you are, being discriminated against, having people discriminate against you and say hurtful things, even possibly be violent towards you because of your gender identity. 20% of people are scared for their general safety if they were to transition. Imagine that. So, you know, wanting to transition, feeling trapped in your body, feeling uncomfortable in the gender you were assigned to at birth, wanting to be your true self and being able to, you know, express your gender identity, but being terrified that if you were to do that, your safety would be put at risk, either by strangers and sometimes even family and friends. What a horrible place to be in, to have to choose between your safety versus being able to express who you are. Over a quarter of trans people in a relationship said that they experienced domestic abuse. A quarter of the people surveyed experienced homelessness at some point in their lives. An eighth of trans employees were physically attacked by colleagues or customers at work in the last year. Again, in the last year only, it's not even their whole life. An eighth of people have been attacked. 48% of trans people don't feel comfortable using public bathrooms. I'm sure we've all seen the horrible debates on Facebook. Imagine not feeling welcome to pee where you want to pee. 2 out of 5 people said that they adjusted the way they look due to fears of hate crime or discrimination, to possibly trying to camouflage yourself, trying to not stand out because you're scared that if you express yourself and look the way you want to, you may be discriminated against or a victim of hate crime. Is it any wonder why there's higher amounts of depression and anxiety when there's so much hatred, discrimination and rejection? 14% of trans university students considered dropping out of their course because they were experiencing discrimination or harassment from both students and staff, either students and staff. Even educational professionals can be abusive. 2/5 of people who would like to undergo medical intervention to support their transition haven't, because they fear the consequences it could have on their family life and the disruption it could cause to their family. And 30% of people surveyed were pessimistic with the way the LGBT rights are going in the country in Britain. Just imagine having to live like this, being scared of your safety, not being able to express your gender due to being terrified of your safety, being isolated and rejected by your family, by society, feeling unsupported by your loved ones. Imagine the mental impact that would have on someone. I wonder mental health and suicide rates are higher in this population. I've got a quote here. This came from Transaction. It was from their Instagram page. So Keith here is saying, you can't escape media transphobia. You go online and it's there. You turn on the telly and it's there. You open a newspaper and it's there. It really weighs on you and makes you feel the whole country is against you. Imagine having to live that life. Imagine the daily microaggressions or inappropriate questions or comments. Imagine all these things you might see on Facebook, mistreating the gender diverse community. Imagine feeling that discriminated against and outcast every single day of your life. That's what we're talking about here. Now, what happens a lot is people may be referred to with the wrong pronoun. And that can make you feel disrespected. It can make them feel invalidated at who they are as a person. It can make their identity feel dismissed. It can make them feel alienated or distressed and dysphoric. Imagine not feeling recognised in your rightful gender. Imagine not feeling recognised with who you are. I'm guessing there's a lot of people watching this presentation who are cisgender. So like I said, this is the gender you were born with and you also identify with. So like me, I was born with a vagina, identify as female now as an adult as well. Imagine if you spent your whole day with everyone calling you the wrong gender. So everyone calling me he, for example, or calling me the wrong name as well. Imagine how annoying that would be for you. Imagine how unrecognised and disrespectful and rude that would feel. And I'm guessing because you may be cisgender, you may be comfortable in your gender, it may not feel as much of a big deal to you as well. But these are people who are not comfortable in their gender. These are people who identify as something else other than what they were born with. So imagine having a different identity and everybody is constantly telling you you're male when you actually identify as female. Imagine the impact that would have when it's part of who you are and your identity. It is so invalidating. So let's go on to the NHS and healthcare. So this is a survey. Again, it's the LGBT in Britain survey. I have used this a lot because it is an awesome article. Just to clarify, this survey covered 5,000 LGBT people in Britain. It's a really large survey, okay, 5,000 people. And what they found is that 13% of that 5,000 felt that they received unequal treatment, and 32% of trans people within that community received unequal treatment in healthcare. 10% of gay men and 40% of bisexual men who weren't out to anyone, so they hadn't told anyone about their sexual orientation when seeking medical care. 30% of lesbians and 23% of bisexual women said that they experienced inappropriate curiosity from healthcare staff. Now, it doesn't state what that is, but you know, I'm sure a lot of people are fed up with those questions like, how do you have sex and things like that. Nobody wants to discuss their sex life. If you wouldn't ask a straight person that, you shouldn't ask a gay person that either. It's inappropriate. And also, unless it's relevant to the healthcare treatment you are having, NHS staff should not be asking you that. It may be relevant if you're in a sexual health clinic, for example, but it may not be relevant if you're in a mental health service and asking someone those questions. That's a high amount of people that have experienced inappropriate questions. 27% of trans people have been outed by healthcare staff without their consent. So what this means is they have probably told a member of the NHS or healthcare staff that they are transgender, and they may not be out yet. So other people socially may not know, whether that's their friends may not know or their family may not know. And that member of staff has outed them. So that member of staff has then told people they're transgender without their consent or without them probably even knowing about it. And 23% of all LGBT people have heard negative or discriminatory remarks about people who identify as LGBT by healthcare staff. Now, let's just take those two things in for a moment. That's a whopping over a quarter of people have been outed by healthcare staff. And you don't know what their family or friendship environment is like. You don't know what kind of problems or difficulties that person may have. And also, it's their right to come out when they're ready, when they choose to, if they even want to. It's not that professional's right to share that information. And imagine this, you've come to get treatment from the NHS or a different healthcare setting, and then you're hearing them talk in horrible ways about people in your community. How put off would that be to then help you access healthcare? I wouldn't want to go to a service where people are being discriminatory and saying disgusting things. 24% of 5,000 people, don't forget, that's a lot of people, were unsatisfied by the support they were given by their GP, their general practitioner. And 1 in 10 LGBT patients were outed without permission by staff, again, to other patients or to other staff as well. It is that patient's right to share their sexuality or their gender identity. It is not the member of staff's right to spread that. And 62% of trans people felt their specific trans health needs were not understood. Imagine that. Imagine not having your healthcare needs understood or recognised or even treated. You're not getting equal or fair care or inclusive care. I would say as well, there are lower amounts of people who have a vagina who don't necessarily identify as female. Maybe they're transgender, maybe they're non-binary or gender fluid, but they have a vagina, not getting their cervical smears. There's been a few campaigns about it recently, and you can understand why people wouldn't maybe want to get their cervical smears given the difficulties we have with healthcare. But again, that's so sad, isn't it? Because it could be meaning that they're missing the screening that they need to have preventative cancer care earlier on. Now, that's horrible. Research also shows, this came from Rethink, the website, LGBT people face widespread discrimination in healthcare settings. 1 in 7 people, which is 14% of LGBT people, avoid seeking healthcare or avoid seeking treatment because of the fears of discrimination from staff, because of their either sexual gender identity, because they're LGBT, they fear seeking healthcare treatment. Now, that is horrible to me, that somebody would fear getting care because they're scared of discrimination from the staff. In the past year, nearly half of LGBTQ youth have wanted counselling from a mental health professional but didn't receive it. That's a lot of people not getting the treatment that they want. And again, mental health rates are higher for this community, and they're not getting the treatment they want. 36% of people received counselling, great, but 48% wanted counselling and didn't receive it. And again, this is recently, this is 2021, this is in Britain, this is youth, so that would be sort of under 18s. That's a lot of people not getting the treatment and support that they need. This figure here is quite surprising. 83% of UK-based non-binary people told us that they've been impacted by discrimination on the basis of being non-binary when accessing healthcare. That is a really high amount of non-binary people that have been discriminated against trying to get the healthcare that they deserve. And that's disgusting, and this needs to change. I want to, I know this is stats that I'm showing you now, so I want to just bring those stats alive a little bit with some real life quotes. So I've got some quotes from Stonewall here. We're constantly questioned on our existence. We're treated hostilely and we're ridiculed in the name of debate. We're constantly exposed to hate and criticism in the media and daily life as the public responds to the media's attitudes. I'm sick of being described as a mentally ill freak. Coming out as transgender was the hardest thing I've ever done. Having to explain it over and over again to medical professionals that were supposed to be helping me almost made me end my life. There needs to be better support for us. It's not their job to educate staff. It's staff's job to educate themselves and understand the people they're treating. Look, it made this person feel suicidal. We should be helping these people and treating them as our patients, not making them feel worse. I got sectioned after a suicide attempt, and a nurse said my mental health problems were due to allowing Satan into my soul. If I just accepted my true gender, then God could forgive me. Now, just imagine this. You've just tried to kill yourself. You're in a mental health hospital. You've been sectioned. You've already gone through a really horrendous time. And now you've got a nurse who is invalidating you and blaming you. You do not need that right now. That's not helpful care. I've also got some pictures from Transaction. So I've always felt scared about visiting a doctor because I don't know if they'll be accepting or not. More training is needed for frontline NHS staff. I feel like the trans community is required to educate the people who are gatekeeping their access to the services they need. And the waiting times are maddening. 3 years or more of waiting is not acceptable, especially when gender dysphoria is your daily companion. I have been speaking to some patients and they were telling me that because of the pandemic, the waiting lists for the gender identity clinic have massively increased. And this particular person was telling me their waiting list was 4 years to get an initial appointment. So not even to have treatment or support, an initial appointment where they assess your needs, 4 years. And again, that's 4 years waiting in a body that you're not comfortable with and you don't identify with. I'm trans, I'm non-binary, and I have multiple health issues. Every time I go to a medical appointment, I have to out myself so that I don't get misgendered in the report. So every time they're seeing the doctor, they have to say what gender they are to make sure that it is written properly. I am also chasing up organisations who have sent me emails or letters addressed to Miss, even though I've put something else. Being trans is a lot of admin, and admin affects my anxiety. Imagine having to spend so much time correcting the pronouns on official reports. And I have seen this in people's medical notes, people saying miss or she, when actually that person may identify as something else and use a different pronoun. How invalidating a professional writing about you and getting it wrong. It may not feel much to you, or it's a wrong thing on a document, but it means so much to someone who identifies in a different way. I'm non-binary and often don't disclose my identity unless I have to. It can cause uncomfortable situations with doctors who are uninformed or transphobic. I hope these quotes just, again, hammer home how difficult it must be to access healthcare if you're LGBTQ plus or if you are part of the gender diverse community. We need to improve as professionals. We need to improve as a multidisciplinary team. We need to improve as a service. We need to improve as the NHS and other healthcare settings. And I think it's good for you to maybe pause this video and really have a think now about the information you've just digested. Have a think about maybe what good practice you've seen. There are good people. There are some fantastic doctors, nurses, therapists, OTs, healthcare assistants, support workers that are inclusive. And I think we need to celebrate that as well. It's not all dismal, but it is very important that we improve. And I really want you to spend a bit of time thinking about how you could make improvements where you are locally in your NHS trust, in your service. How could you improve things for these patients? Pause if you want to, but I'm going to carry on the video. So this is a really interesting piece of data that I came across, and it just goes to show why pronouns are so important. So this is a survey in the United States. It includes 35,000 LGBTQ youth, so people aged 13 to 24. This is a massive survey, okay? In this survey, they asked, if you live with other people, how many of those people you live with respect your pronouns? 49% of the people surveyed, out of about 35,000, said none of the people they live with respected their pronouns. That group had higher suicide attempts. 24% of that group attempted suicide. I just want that to sink in for a moment. In households where your gender pronouns are not respected, there are higher rates of suicide. In households where people respect your pronouns, there's 19% suicide rate. It has reduced, as you can see. 29% of people surveyed said that all of the people they live with respect their pronouns, and the suicide rate for those has reduced, as you can see. Now, that doesn't mean to say that people whose pronouns are respected aren't going to attempt suicide, because they still live in a really hostile and discriminative society and have a lot of other difficulties up against them. But as you can see, there's a really strong correlation here between if we don't respect someone's pronouns, the suicide rate goes up. So what that shows is that pronouns respected by all of the people they lived with had a half rate of suicide compared to those who did not have their pronouns respected. And it goes to show that affirming someone's gender identity, which means seeing them as the identity that they identify with, using their pronouns, using the name that they identify with, is strongly associated with lower suicide risk. Now, when we work in healthcare settings, I work in mental health. I think it is very important that as healthcare professionals, we use a patient's right pronouns, especially in mental health services where we're trying to prevent suicide, but actually in all healthcare services, we don't want to be a part of this problem. We need to support change and support that person to express their gender, because it does help lower suicide risk. That's massive. Respecting a person's pronouns is suicide prevention. Well, you've just seen the data to agree with that and back that up. James here from Transactions says, people constantly ask me for my real name and love to tell me that they can get behind drag queens, but that they draw the line with people taking hormones and mutilating their bodies. Not that that's what they're doing. Hearing this stuff from most people I encounter is really draining for my mental health. I feel like my very existence is rooted in politics. And I would say, James, rooted in a lot of hatred and discrimination. It's not fair that you have to fight to be recognised as a human being who deserves to be treated with respect. So I've used the word dead name a few times. What dead name is referring to is the name someone was assigned to at birth. So for example, if someone was born with a penis and they were assigned male, let's pretend their name is Tom. If Tom identifies as female, Tom may want to change their name. Tom may want to call themselves Tammy, for example, and that would be their new name. Tom would then be their dead name. It's a name not associated with them because it's not associated with their gender and they don't use that name anymore. Now, using someone's chosen name, using the name that they choose, is linked to reduced depressive symptoms, reduced suicidal ideation, and reduced suicidal behaviour amongst transgender youths. Using someone's name that they have chosen helps to affirm their gender and it helps to lower the mental health risks. Again, it just shows how important it is to make sure you get someone's pronouns right and their name right. It has also been shown to improve mental health outcomes when you get this right. And again, if we are NHS professionals, we want to help to treat the people that we care about. We want to improve their mental health outcomes. So it's very important that we get this right. We use their proper names and we use their pronouns. So there are lots of pronouns that are used. Often we hear she, her, hers, he, him, his. Sometimes people call that male or female pronouns. Some people would prefer a pronoun such as they, so more a neutral pronoun. They, them, theirs, so not he or hers. They is quite a common, it's a neutral pronoun. There are other ones, so Z, for example, here, Z, pronounced like Z. Again, it's quite a neutral pronoun. Some people prefer Z, them, zir, themself. The, the, this, their self. Some people don't like pronouns at all. They just want their name to be used. Ash ate Ash's food because Ash was hungry. You don't need to use him and here, and some people him and her, and some people don't want you to. So yes, there are a variety of pronouns that people use. How do you think you know what ones to use? I hope it's obvious. You ask that person. We can't assume someone's pronouns, just the same as you can't guess someone's name by looking at them. So it's best just to ask them. A nice way of doing it is, hi, my name's Molly. I use she and hers. Can I ask what your name is and what your pronouns are? That gives them a good opportunity to introduce theirs. Or you can just ask someone, please, can you tell me what pronouns you'd like me to use? It's respectful. It's a good thing to ask. Please never refer to somebody as it. That's really dehumanizing. And he, she is a nasty slur that people would not like. They're offensive. Do not use those. And again, you don't have to understand someone's identity to respect it. If you don't understand someone being gender diverse or transgender, that's fine, but you can still respect it as a member of staff, and you can respect them as a human being. You don't have to agree with it either, but you can still be decent and respect someone. Lots of people haven't heard a lot about gender diversity or may struggle with the terms. They may not fully understand it all. I mean, it's good to educate yourself. But again, even if you don't understand it, you can still respect someone. They still deserve to be treated as a human being with respect. You wouldn't like someone to misgender you, so please don't do it to someone where gender identity is very important to them. So I do want you to have a think about sort of other things that you can do. So again, please always ask, don't assume. Ask for pronouns, ask for names. Once you know someone's pronouns and names, it's also a really good thing to put it on their documents or their handover boards or whatever system you use in the NHS. Make it very clear. Use the language that person uses for themselves. Everybody identifies slightly different. No two transgender people are the same. So follow their lead, follow what they like, what language they want you to use. And like we said, if you don't know, ask. It's respectful to ask. I know a lot of people get anxious. Oh, I'm going to make a mistake. I'm going to use the wrong pronouns. Again, don't make a big thing about it. Sometimes that can just draw more attention to it and make it awkward. Apologize and move on. You've made a mistake. Let's carry on. Let's not make it into a big deal. Be careful and considerate about what questions you ask. Again, there are many topics that are very personal. I certainly wouldn't want you to ask what genitals I have or how I have sex. It doesn't mean it's appropriate for you to ask someone in the LGBT community those questions too. It may be appropriate if you're a GP or if you're from a sexual health condition and you're talking about sex or genitals to ask those questions. But if you're working in a setting like me, mental health, it's not appropriate for me to ask what's between your legs, because that has nothing to do with your mental health or what I'm treating you for. And again, if a patient wants to tell you physically what is between their legs or anything else, that's up to them. But only ask these questions if they are relevant to the work you are doing. If you wouldn't like those questions, then why should they have to answer them? It's always good to ask yourself, do I need to know this information to treat them respectfully? Do you need to know that information, or are you being inappropriate and curious? Would you be comfortable if this question was turned around and asked you? If you don't want to answer that question, why should they? And please do find out if their family knows. Do their family know that they're gender diverse? Do their family know they're transitioning? Do their family know they're non-binary or gender fluid? Don't just out them and assume they know. You could cause a lot of damage there. So ask the patient, do your family know about this? Would you like me to use your pronouns in front of them? Would you like me to treat you differently when your family are there? If they don't know, don't use their given identified pronouns, because you're outing them subtly. There is also some research that shows that if you use someone's pronouns behind their back correctly, you're more likely to use them correctly to that person's face. So when you have your staff meetings, your MDTs, your handover meetings, make sure that you are using that patient's proper name and proper pronouns, even when the patient isn't there, because you're more likely to use it correctly that way. Very important. We all get in that habit. And also just see that person as what they identify with. If they identify as male, see them as male, use their male name, male pronouns. If you just treat them as they are, who they are, then you're generally less likely to make mistakes as well. So I do want you to have a think after learning this information. I want you to consider how you're going to take action to improve things. So there are lots of ways to be a good ally. We've got rainbow lanyards and rainbow NHS badges these days, and most trusts have those if you speak to your equality and diversity team. I had to make a pledge to get mine. It's a nice way to demonstrate you're an ally and to show your patients as well that you're a safe person to come out to and to speak to. It's really good to take a look at your own practice and reflect on how you've treated gender diverse or transgender patients so far, and consider how you can improve personally as a clinician. Please do make an active effort to respect pronouns and use their chosen name. Ask your patients relevant and sensitive questions, not just questions because you're curious that has nothing to do with their care. Be just a kind, sensitive and empathetic professional so that we can improve healthcare services and improve a better relationship with our patients and have a better reputation so patients aren't scared of getting the care they need. They feel comfortable speaking to us. Wouldn't that be great? I think it's really brave but really important to correct pronouns. If a colleague isn't being sensitive, they're saying the wrong things, it's good to correct them and hold each other accountable. It may be scary, but it's important. Point out good practice too. When someone's doing good stuff, let's encourage that. Let's keep it going. There's a lot of guides on the internet about being a good ally and how you can do that. It's good to read them. And I think we should all educate ourselves, whether that's learning terminology, watching documentaries, reading about LGBTQ+ issues. it's really good to just understand difficulties people face a bit more. Learn about LGBTQ plus support services, especially local ones and charities and national nines, so that you can help those people get the support they need. You may want to donate to a charity related. You could volunteer at your local Pride as well. Most years I've been going and handing out sort of mental health leaflets to promote people getting the help that they need. But we're always wanting support and volunteers. You could sign petitions, you could learn about campaigns to support people's rights. These are just a few ideas, but I'd like you just to spend a few moments to think about what you could personally do. Just before we end, this is a page with my references. So I have used these two documents a lot. So Stonewall LGBT in Britain and Being Trans in Britain. I have used the Trevor Project a lot. They have some really good information on, again, LGBT, trans and gender diverse experiences. Trevor Project also do a good document on how to be a good ally with some tips if anyone's interested. These are all of the references that I have used to make this presentation today. So if you want more information, have a look at these sites. Just before we end, these are also some general good places that I think everyone should know about. So Minds do have a LGBT sort of peer support community. They also have an info line that you can call. They have a transgender line often as well. It's a really useful support, and again, very helpful to sort of find out what mental health and community support's available for you. There's Switchboard, which is an LGBT helpline. If you want to talk things through, if you want to get advice, if you want to find out places that can help you, Switchboard is a really good number. There's the LGBT Foundation as well, and they support all sorts of LGBT issues. It's a really helpful helpline. There's some more practical numbers if there's any difficulties with domestic abuse, conversion therapy, hate crime. These are some really helpful helplines for those topics. Pink Therapy is a good site where you can find an LGBTQ plus friendly therapist for anyone who's seeking private therapy outside of the NHS. You've got a MAM, which is a charity. They support LGBTQ Muslims, and they provide an online forum where you can share experiences and ask for help. There's Consortium, which is an organisation helping to sort of help people meet up and find local mental health services. And the LGBT Foundation we've talked about already, but again, they provide information, advice and support services, including a talking therapies programme. Just to finish up, we've got some more helplines here. Gallup is very helpful for hate crime. Switchboard we've talked about. Mind, the helpline. Mermaids is quite a useful service too. There's some other websites you might want to check out too. The Vermont Society I hear lots of good things about. That seems to be quite popular. Please do check these out. If you yourself are LGBTQ+, or if you want some signposting and places for your patients to go to get help, I would recommend you start having a look at these, but do find out what's available for you locally as well, because there's some amazing stuff out there. If you've come this far and you have watched the whole presentation, I want to say thank you very much. I really appreciate you listening today. Like I said, I'm not perfect myself. I am still learning, but I hope you found this helpful. Please feel free to share this with any professionals. I'm really happy for it to be used. And if you want to see me on Instagram, like I said, I'm CBT and me, and you can have a look at my sort of self-help and psychological information. Thank you. Bye.